I think this is an important point because obviously in Italy we faced a very dramatic situation starting from March, and that's when the lockdown started at the beginning of March. And obviously one of the worries was in hematology, what would happen to our patients with various hematological malignancies, thinking that many patients, this ties to CLL, for instance, are not kids anymore. They may be in rather advanced age. Number one. Number two, that they may be immunosuppressed by the disease and also by treatment. And again, CLL is a typical example because patients are immunosuppressed. And third, obviously, to see how COVID could therefore play a role or impact on patients or on the management of patients, which is equally or even more important. So in Italy, we have a program which is called Campus, which I must say started with ALL years ago, about 5 years ago. Then we extended Campus for CLL and one for CML, chronic myeloid leukemia. So if we turn to CLL, we organized a survey through the centers participating in a campus, which are about 50, covering the whole of the country. And to make a long story short, I mean, the first survey we did was in April, so at the peak of the pandemic in Italy. So these data go back to that period, and we have to keep this in mind, and I'll say this in a minute. So when we did this survey, to our surprise, I must say, what we found at that time was that very few patients with CLL, very few symptomatic, this goes to our days now, asymptomatic versus symptomatic. In those days, the question was how many symptomatic patients with flu-like syndrome or who had been in contact with COVID-positive individuals had actually, CLL patients had actually become symptomatic COVID positive. And to our surprise, at the end of April, we only had very few patients who were COVID positive, a very small proportion. And the was, I'm going through my memory, was on about 9,000 CLL patients in Italy or something like that. So about a third of the population of CLLs in the country. So a very, very low percentage of symptomatic COVID patients. Again, and this in a way was a surprise. At the same time, however, we posed a number of questions on how the COVID pandemic had impacted on the management of CLL patients. And what has come up in CLL and more in general, obviously, is that during the pandemic, we've seen less new patients in general. And just to, in brackets, I would say that maybe in CLL, this is less relevant, maybe, but think about acute leukemias or advanced lymphomas, and this is exactly what has happened. So people are not referred, maybe by the family doctor being worried, or the individuals or patients themselves not wanting to go and postponing possible visits. So there's one point. Second point is that it had emerged also that an impact on treatment decisions. You might postpone starting of treatment. You might also change your treatment decision. And it came out also that this had an impact on the follow-up of patients. And it had an impact and has had an impact on the enrollment of patient clinical trials. So what I'm leading to, and we've seen this in many conditions, is that this is a major, I would say, impact that people don't really think about that much. You think about how many patients are becoming COVID positive, but it's equally very serious if you're not managing as you would like to do patients in a non-COVID time. So that is an impact. After that, we did another study, and this takes us to Eric, together with Eric, in fact. And while this first one was published in Blood, the second study putting together data from Italy and from Europe was on a large cohort of patients with CLL, but that was more focused on in fact, the impact, clinical impact on patients who are positive. And this joint Eric Campus effort was published in Leukemia.